So we set NECRET up to allow us to enable more research so that we could improve the care for people with cancer in the northeast, and also look towards earlier detection, because earlier detection of cancer can improve patient outcomes. So we do it by using the funding from NECRET to enable an increased volume of research in our labs here at RCSI. And for example, at the moment we're using NECRET funding in the labs at RCSI to explore a new way of treating women who have breast cancer. We're also exploring a new way of diagnosing lung cancer earlier, so that we can potentially improve outcomes for people who are afflicted with lung cancer. Ultimately, we translate discoveries in our labs that NECRET funds into the clinic through clinical trials, again with the assistance of funding from NECRET. And clinical trials are the first way that we deliver improvements in care or diagnosis to people with cancer. So again, NECRET has helped us do clinical trials exploring a new treatment for women with an aggressive type of breast cancer called HER2-positive breast cancer, and it's also allowed us to introduce a new treatment for people with pancreatic cancer into the clinic. So ultimately, we use the funding from NECRET to translate into improvements in care and earlier diagnosis for people who have cancer in the northeast, and this enabling of research we expect ultimately to translate into improved patient outcomes.
So we couldn't do the research that we do in the lab without the support of charities like NECRET. NECRET funding has continuously allowed us to purchase the reagents and consumables that we need to carry out our experiments, and it has previously funded a full-time research scientist. NECRET funding has also allowed us to purchase essential equipment. We've recently bought a fluorescence microscope, and the fluorescence microscope allows us to visualize cancer cells, and then we can see how these cancer cells change when we treat them with different drugs. We've also bought a real-time PCR machine, which allows us to measure the levels of different genes in cancer cells, and we can see then if levels of these genes increase or decrease in response to different treatments. And taken together, these allow us to see if a particular drug treatment can kill cancer cells. NECRET funding has also allowed us to buy gene sequencing machines, and these allow us to identify gene changes called mutations in tumours, in patient tumours, and these mutations can predict if a cancer is likely to respond to a particular drug or if it's likely to be resistant to the particular drug. We've also bought a centrifuge recently, and the centrifuge allows us to separate blood from cancer patients into different components or parts. And we can use these different components of blood to find out more information about the patient's cancer and also see if the patient's cancer is responding to treatment.